Hi friends, on today's class let us see about diabetes mellitus. And nowadays diabetes mellitus are very common. It is seen in the young children and as well as infants, and we know older has diabetes mellitus. Okay, so what is diabetes mellitus? Diabetes mellitus is a condition, a serious condition in which it is caused by a metabolic disorder. Okay, it is a metabolic disorder and it is caused by some several factors which we are going to see on the etiology one by one. And there will be a abnormal metabolism. So due to this some factors get affected, like mainly on pancreas. Okay, only pancreas produces alpha cells and beta cells from the islets of Langerhans. So alpha cells produce a hormone called glycogen and beta cells produces a hormone called insulin. What insulin does to the body? So let us see what insulin does to the body. First of all, when we taking the meal, after eating our meal, what happens? The carbohydrates, the fats and the proteins are broken into glucose and amino acid. The carbohydrate broke into glucose and the amino acids was from proteins. Okay, so these two will be traveling in the bloodstream. Okay, when it travels in the bloodstream, the pancreas stimulates insulin. Okay, when glucose was there in the bloodstream, pancreas stimulates an hormone called insulin from beta cells. So when insulin stimulated, the insulin stimulate glucose to be moved to the liver. Okay, so it touches the glucose and it says that glucose please go to the liver. So this liver stores for future use. Okay, when this insulin was not yet there, if there is any related on insulin action, okay, it was any defect in the insulin action or insulin synthesis was not there, diabetes mellitus will be caused. And the main notable thing is hyperglycemia will be seen in diabetes mellitus. So here diabetes mellitus is a serious condition. It is without a curable, without a curable disease. Okay, it can be treated and it can be prevented, but it is not cured. It has an associated with an significant mortality and morbidity. And it is a serious condition which is associated with acute and chronic stages. Acute in the sense it will be due to hyperglycemia, and chronic in the sense it will be due to any vascular damage. Okay, so let us see about the types of diabetes mellitus. The types of diabetes mellitus are type 1 diabetes mellitus, type 2 diabetes mellitus, gestational diabetes mellitus. These are the most common diabetes mellitus, and other uncommon diabetes mellitus are a genetic defect in the beta cells, genetic defect in the insulin action, and any genetic syndrome like Down syndrome due to an infection or due to a drug intaken. And so the pancreas has both exocrine activity and endocrine activity. Okay, so the exocrine destruction of the pancreas. So these are all the other uncommon cause which causes diabetes mellitus. Now we can see on each. Okay, so the first will be diabetes mellitus type 1. It is an insulin dependent diabetes. Here what happens in the type 1 diabetes? So it is a childhood onset. Okay, and type 2 will be the adult onset. Type 1 diabetes is also known as insulin dependent diabetes, whereas type 2 diabetes mellitus is also known as non-insulin dependent diabetes. So here if see here, if this is a pancreas, okay, if this is a pancreas, it produces alpha cells and it produces beta cells. So beta cells produces insulin, right? But here what happens in type 1 diabetes mellitus, the beta cell become destroyed. Okay, the beta cell destruction which causes insufficient or no insulin secretion to the blood, okay, which causes hyperglycemia. Okay, so if insulin doesn't stimulate the glucose, the glucose will be in, still it will be till the life, still it will be in the bloodstream. So the glucose should be not in the bloodstream. Hence, if we tested the blood, there will be a hyperglycemia. Okay, so beta cell destruction. This beta cell destruction won't produce insulin, and hence type 1 diabetes mellitus occurs. It can be, the causes will be, it can be due to genetic or environmental or immunological. Yes. And what is type 2 diabetes mellitus? Let us see. See, this is a pancreas, head, neck, body and tail. The pancreas structure, anatomy of the pancreas. Here what happens in the diabetes 2, type 2 means the beta cells, see alpha cells is present here and also beta cells will be presented here. Here the beta cells become destroyed and destruction happens in beta cells here. But what happens here? The function producing by beta cells is not there. Okay, beta cell dysfunction happens in type 2 diabetes mellitus. Okay, and there will be an insulin resistant. So suppose, so this is a receptor. Okay, every molecules and every hormones need a receptor to attach and bind and to do their actions. But what happens here, if this is a insulin, so let us assume this is a insulin, the insulin will not bind, it become resistant to the insulin receptor. So due to this is the first factor and this is the second factor which causes type 2 diabetes mellitus. Once again, there will be a beta cell dysfunction. Okay, here the beta cell destruction happens, whereas here beta cell dysfunction and insulin resistance take place, which was enabled to produce the action of insulin and insulin secretion was low. Both happens is here. What is gestational diabetes? See, this is diagnosed during pregnancy. Okay, gestational means pregnancy. So during pregnancy it is diagnosed and it is it has a certain factor. Okay, so that is a factor, pregnancy factor. Pregnancy factor is there, okay, which is known as human placental lactogen. Human placental lactogen. I have told you already, there will be a resistant in this. Okay, insulin resistant will be there and insulin won't bind to the receptor. But what happens here? The receptor function is disabled. The receptor does not or do not function well or properly. Okay, the receptor function was not proper here and hence due to the factor called human placental lactogen. This human placental lactogen during the pregnancy life, it interferes with the insulin receptor. And this is about gestational diabetes. And this gestational diabetes mellitus has an increased risk on causing type 2 diabetes. Okay, so let us see what are the risk factors comes under this diabetes mellitus. So the risk factors will be due to obesity, family history and stress, medication on certain administration or ingestion of certain medication, and then any stress, inactivity without doing any physical activity. Okay, so these are all the causes and risk factors of the diabetes mellitus. Coming to symptoms, we should know the 3 P's. Okay, the 3 P's are polydipsia, polyphagia, polyuria. So these are the 3 P's we should know in diabetes mellitus. Okay, so increased thirst, increasing in urine, okay, and difficulty in swallowing, more swallowing will be there. Okay, and fatigue will be there. Fatigue, blurred vision, So these are all the symptoms which take place in diabetes mellitus, right? And on investigation, first we have to see fasting blood sugar level. Okay, fasting blood sugar level normally after meal 8 to after we should not take the meal up to 8 to 12 hours. Okay, and then a blood test will be done. So that is fasting blood sugar. In this case, the normal level is below 110. Below 110 means normal. 110, below 110 means normal, and below 110 to 126 is pre-diabetic. Pre-diabetes, and more than 126 will be on diabetes, assumed as diabetes. So we should first further investigate a fasting blood sugar level. After reaching this level, if pre-diabetes or diabetes comes in the conclusion, we should move to the next stage, that is postprandial blood sugar. Postprandial blood sugar level is nothing but the glucose which is present in the bloodstream. Okay, so we should have that thing. And here what happens, the meal is not taken for 8 to 12 hours and the test will be done. So they will know, they will give a glucose. Okay, we should consume it and they will test this postprandial blood sugar level. The normal thing here is less than 140 milligram per dl. This is a normal value, less than 140. Okay, and 140 to 200. 140 to 200 milligram per dl will be pre-diabetic, and more than 200 milligram per dl will be on diabetic. Okay, after reaching this point, we have to move to the hemoglobin A1 stage. Okay, so let us see the normal level. 4 to 6, this is a normal level. 4 to 6 is a normal level, and 6.1 to 7 will be the target range for diabetes is 6.1 to 7. Target range. And coming to 7, more than 7, let be more than 7. So this is the diabetic, that is poor control, poor in control. Okay, and the last we can diagnose with lipid profile. In lipid profile we can be able to separate like low density lipid, serum triglyceride, and we can also define as high density lipid. In low density lipid, see, lesser than 100, okay, lesser than 100, 100 to 129, 130 to 159, 160 to 190, and more than 190. So this is a value that we should remember. If lesser than 100, it is a optimal level, and 100 to 129 near to the optimal. 130 to 159 will be borderline high, and 160 to 190 will be high, and more than 190 will be very high. Okay, these are the values of low density lipid. And triglycerides is serum triglyceride. So it should be less than 150. So this is the normal level, less than 150. Now 150 to 299. 150 to 199. Okay, 150 to 199. 200 to 499 and greater than 500. So these are the values. If lesser than 150, the serum triglyceride level is normal. 150 to 199, that is optimal. So lesser than 150 will be optimal. 150 to 199 will be borderline high, and 200 to 499 will be high. Greater than 500 will be very high. Coming to HDL, in high density lipid, so lesser than 40, greater than 60. Lesser than 40 it is low, and greater than 60 it is high. So these are the normal values we should know when we are diagnosing the diabetes mellitus. Okay, and coming at last to the treatment. So treatment on the lifestyle medium, we can use it to reduce the sodium level. Okay, so salt can be reduced and doing physical activities can be done. So these are the lifestyle activities can be done in diabetes mellitus to control them. Okay, and we should take a regular medication as oral hypoglycemic agent. On the next video I will be taking the classification of oral hypoglycemic agent, and then we have to see insulin therapy. Okay, insulin therapy can be given. So this is the treatment: diet and exercise, oral hypoglycemic agent, and insulin therapy. Okay, this is about the diabetes mellitus. If you have any doubts, comment in the comment box. Until then, this is Nandu. Take care, be safe, and bye.